So hello everyone, and today we'll be discussing a spotter case. So this patient came with symptoms of vague headache since 3 days, and he got a CCT brain done for that. And this is an incidental finding that I picked up on the contrast scan of the brain. This is the axial section. Here we can see that there are some prominent veins which are seen draining into the superior sagittal sinus. Some prominent cortical veins in the frontal region draining into the superior sagittal sinus are seen here. So it's actually a spotter. So this is the report that I had given, that there was prominent left frontal cortical vein and some small collector veins in the left frontal region draining into the anterior superior sagittal sinus, and there was no nidus that was identified, and there was no evidence of any hemorrhage, so suggesting a developmental venous anomaly. So what exactly is a developmental venous anomaly or a cerebral venous angioma? It's actually a congenital malformation of veins which drain the normal brain, and they were thought to be rare before cross-sectional imaging, but now they are recognized to be the most common cerebral vascular malformation, accounting for 55% of all such lesions. It is characterized by this sign called caput medusae sign. This is actually a spotter where the veins draining into a single layer of collecting veins, which in turn drain into a dural sinus or a deep ependymal vein. The appearance is of a palm tree. This is actually like a palm tree, hence it's called a caput medusae sign. These are the SWI images. So coming to the clinical features, developmental venous anomalies are usually incidental findings, as was there in this particular case. However, patients may present with intracranial hemorrhage, and also association with ischemic stroke and epilepsy has been described. Location, most common location is in the frontoparietal region, usually draining towards the frontal horn of the lateral ventricle, which was there in this particular case. Other locations include cerebellar hemisphere draining towards the fourth ventricle. However, DVAs can be anywhere, draining either superficially or deep. Associations, lesions are usually solitary, about 75% of the cases, as was in this particular case, except in case of blue rubber bleb Nevus syndrome, and in 20% of the cases are associated with cavernous malformation, referred to as mixed vascular malformation. They might uncommonly be associated with cortical dysplasias.